Well, folks, I have a good conversation here about an upcoming opportunity to kind of get some more information about what goes on as people age in rural communities. Mason Health is putting this on in association with UW Medicine. I have on the line Justin B. Miller, PhD. He's the principal investigator for the University of Washington. Justin, how are you doing?
I'm doing great. Thanks for having me.
For sure. And this is an interesting opportunity for folks. And I wasn't aware of this until I started doing a little more research before our conversation. But folks in rural communities like Shelton and Mason County, for some and apparently unknown reason, have a higher risk of Alzheimer's and dementia. And so there's a new initiative at UW that wants to kind of study this. Is that right?
Yeah, that's absolutely true. Um, there's a lot of work that's been done in Alzheimer's disease and related dementias. And most of that work has really been done at big institutions, large medical centers, hospitals. And those hospitals, those major institutions are usually inside of urban and dense suburban metropolitan cores, because that's where the critical mass is, that's where the infrastructure is. And what ends up happening is it kind of leaves out all of the people who live outside of that metropolitan area. And so there's a number of potential things that might contribute to that, which we can surely go into, but what we do know is that as we've started to look more broadly, we're seeing that people who don't live in an area that is considered urban or suburban, these smaller towns, smaller communities, rural towns, um, there's more risk. We're seeing higher numbers of dementia. We're seeing delays in diagnosis. We're seeing higher rates of mortality due to Alzheimer's disease, with some estimates that suggest that that risk is 80% higher than in an urban community. And you're spot on. We don't really know why.
I'm no doctor here, but if knowing the community of Mason and the ruralness of the attractiveness of being rural in a community, the first thing that I kind of think about is more and more folks are on their own, in a sense. They're, back in the woods of Mason County, and they may not have an opportunity like in urban areas to join as many larger community groups or visit as many senior centers where you engage and keep your brain maybe moving a little bit more than you would if you have the chance to just walk down the street, if you're in a major metro like Seattle, to a coffee shop or a facility where folks are gathering. That's kind of the first thing that I thought of. What do you think on that one? Who knows?
Yeah, I think it's an important consideration. And let me kind of take this to a bit of a bigger picture with that. What you're referring to is what I call the social environment or the social exposome. All of the factors and the conditions in which people live and in which people age, which they grow old, and where they receive care and spend their time, we know that that influences your health and your health outcomes. And I think that there's infinite unique attributes to living in a smaller town or a rural community that are not the same exposures to what people who live in a metro metropolitan, like a city core, would have. I think that, for one thing, provider access, I think Mason Health is an amazing institution. They have wonderful providers. They have outstanding clinicians and amazing people working there, and they do really, really great things. But that's not the case everywhere. And I think that there's a huge gap in access to really advanced specialty care for Alzheimer's and dementia. I think that's a part of it. And to your point, getting to the doctor or getting into a connection or a clinic with someone who really has the expertise isn't as easy. I think another part of that too is that, there's a lot of social connectivity that comes in as we grow older. And you mentioned community centers, recreation centers. Interestingly, there's some evidence that suggests that rural communities actually have more tight-knit social fabrics and communities, which could be a protective factor in some regards. But at the same time, there also might be a collective limited understanding or less familiarity with Alzheimer's disease, with dementia. I'm having trouble coming up with words. Is that a normal change? Oh, you're finding that too? Oh, it must be normal. We're all going through this. Well, it may not always be normal. So part of our goal is to increase education and awareness around normal aging and cognitive change, but also about what's abnormal and when to go see a doctor. I mean, so I think that's a bigger part of it too, is when you live in a smaller area, you might have great social connectivity. You might have great relationships and a really good community of social support around you. But if there's sort of a foundational lack or limited understanding or education or awareness around some of these things, that social fabric may not be as protective as it would be in a community where there is more of a common discussion around these things. Does that make sense?
It does. It does. So it sounds like you're going to start to do some of the legwork here in these rural communities. And Shelton, Mason County is a great place to talk about this. And again, as I look at kind of the eligibility factors for your upcoming participation in these types of things, over the age of 50, lots of folks in Shelton, Mason County that check that box. Rural communities, of course, blood sample provision there from folks. And then, of course, you can go to Mason Health to do that. And then it's not a lot of additional requirements for folks that want to participate this and be able to help out. There is also going to be, and let me know if you have that date set on this, but a conversation about brain health and Alzheimer's. It's where folks are going to be able to sit around for a couple of hours and talk about what it is to have a brain healthy lifestyle, what kind of normal and abnormal aging things that people should be concerned about. Kind of like what we were just talking about. Is this a normal thing? Not remembering words and stuff like that. And then also the signs that I'm imagining caregivers, children of folks of age are able to see these signs as well. So there is a conversation upcoming. Is that right?
Yes, there definitely is. And I'm still working on exactly when that's going to happen, but
Okay.
that's going to be done in partnership with Mason Health, of course. We're working on ironing out those details. But yeah, the goal is absolutely, at a foundational level, like I said, one of the things I want to do at the outset is I really just want to bring information. I want to share knowledge. I want to increase awareness about aging, about dementia, about Alzheimer's disease. I get a lot of questions. I'm a clinician as well. I have a clinical practice where I see patients still as part of my work. Research is a big part of my role, but all of the things that I do are very clinically based, clinically applied. And so I'm always approaching it from a mindset of how can I help people? And so, I think starting at a level where we really just start answering questions. I know that there's a lot of people out there who live and, have questions about, I'm seeing this, is this normal? Or when should I see a doctor? Or my spouse, my husband, my wife, my brother, my sister, my neighbor, they're all going through some of these things and I'm not sure how to help them. Like those are the types of things that I want to start with, because I feel like arming people with information and education is so important that it's the foundational step before we really can take this to the next level to try and understand at a bigger picture what's going on. And I can go into more detail about the Northwest Brain Health Initiative, which is really the project that we've conceptualized and that we're bringing to Mason County. But yeah, you're right that the first step is really to get people aware of kind of why this is important, answer questions, increase education. We're going to do that throughout the county. And these are all going to be free conversations. These are going to be things that, I'm going to be there. Someone from my team is going to be there. And we're going to come out. We're going to talk about things that you want to talk about. We're going to answer the questions that you have. And we're going to help people learn, about what it means to age and how brain aging can go awry.
Have you talked with colleagues and other counterparts across the state when it comes to the Rural Brain Health Initiative on other differences between the different parts of the state, even between Eastern Washington and Western Washington, and how different lifestyles, perhaps, or more active lifestyles in either side help to benefit folks as they continue to age? Is that part of how you're going to look at this as well as you kind of get a wide swath from the state?
Oh, for sure. Yeah, so remember that whole idea of the social exposome that I talked about, sort of the conditions and where people live. I'm not going to make any assumptions that someone who is aging in Mason County is going to have the same experiences as someone aging in Yakima County or in the Tri-Cities. And so my goal over time really is to grow this program into something that is much larger and representative. You know, if I had my druthers, I'm a big thinker. If I had my druthers, I would make this a nationwide project. But we're going to start. I mean, our first site, our first partnership is with Mason Health in Mason County. And there's a whole bunch of reasons why we picked Mason as the inaugural site for the Northwest Rural Brain Health Initiative. But I think it's really a good place for us to plant roots and to really formalize our connections and really meet people where they're at. You know, to talk a little bit about the program itself as a whole, you know, I talked a little bit about one of our initial goals is really to just increase education and awareness, and that's absolutely true. The other thing that I mentioned earlier, just very briefly, is that, you know, a lot of counties, a lot of communities, a lot of rural areas don't have access to the specialty diagnostic services that are really necessary for a really robust, strong, reliable diagnosis of Alzheimer's disease or another dementia syndrome. And that's what we're going to bring. And so the Northwest Rural Brain Health Initiative, we're going to come out and we're going to do all this in community. People are not going to have to travel all the way to Seattle. This is something we're doing right there in Shelton. I've been out there a whole bunch of times. It's an absolutely lovely community. I love coming out there. And we're going to provide people with cognitive tests. We're going to provide people with clinical blood labs. We're also going to collect some research-specific things for blood biomarkers to help us understand what's happening in the brain just through blood. It's normal blood draw, nothing fancy, nothing experimental about it. And then we're going to spend some time talking with people to learn about, you know, their education, their background, their work. What did they do for a living? Where have they grown and spent their time over their lifetime? You know, some people have been born and raised and lived their entire life in Shelton, and that's incredible. There's other people who live in Shelton now that maybe they were born and worked in Manhattan, New York, and chose smaller community life. Those two individuals, they might live in the same community, but their social experience over their lifetime has been totally different. And so we want to systematically look at these kinds of things to try to understand, how does individual aging trajectories differ as a function of the things people experience over their lifetime? But the most important thing that I think is that we're bringing resources to the community. For people who participate in our project, I'm going to give them a copy of their clinical labs that they can take to their doctor. I'm going to give them a copy of their cognitive testing results to take to their doctor. I'm going to give them a classification based off of my clinical impressions, but it's really a research thing. It's not a clinical thing, but it's a classification of where they stand cognitively. And I'm going to give that all back to people without charge, because this is not the kind of thing that, you know, that we're going to ask people for money for. In fact, we're going to pay people for their time and participation, but we're also going to bring all of this material back to people to try to make a direct impact on someone's life so that they can get information to learn, like, hey, I'm aging normally, or maybe I'm at risk, or maybe I've already got some problems, and then they can work with their doctor on what to do with that information. And maybe they have a doctor that they love. They've got, I mean, there's amazing docs, and maybe their doctor doesn't necessarily know the best things to do with that, or what to do with that information, because that's another challenge that we see in healthcare. And so my colleagues and I at University of Washington, we're going to work with the providers in community to increase their education, their medical education, their ability to utilize this information, collectively trying to do what we can to improve the overall healthcare access and support for people aging.
It's a good collaboration here. Obviously, Mason Health is deeply ingrained in our community, and UW Medicine comes with its own gravitas there, the Memory and Brain Wellness Center at the UW. in addition to this, it's interesting too as we talk about aging in Mason County. A couple years back, there was an organization that was kind of focusing on the rural aspects and creating one of those kind of like blue zones in the Shelton Mason County area, which again looks at kind of longevity and social interaction and how people adapt their different lifestyles to live longer and things like that. So it's another great addition to what goes on here in the community for folks who are so interested in maintaining a healthy and active lifestyle, of which, I think a lot of residents of the county and in Shelton in particular are really proud to have, with the access that we have to the water and the different water sports or hiking or different mountain climbing, all those things, keeps these folks active and out there and getting involved in the community, which I would imagine, as we kind of spoke about a little bit, helps reduce a lot of those risks of Alzheimer's and dementia. So we're going to keep updated on this. When you get that date settled in, we'll of course mention it and get people involved there on the radio. I'll put the information on how people can contact you with more questions regarding the overall study that is going to be upcoming and ongoing, as we're talking with Justin Miller, Dr. PhD here, the principal investigator for the University of Washington, as he's looking to kind of understand a little bit more about what happens in rural communities when it comes to the higher risk of Alzheimer's and dementia. Very cool. Nice to talk with you, and really nice to see you here and get a chance to learn more about this, as it really impacts our community.
Yeah, absolutely. I'm so excited about this work. It's something that I've been doing this for a long time. I'm relatively new to Washington myself. I just moved up here about a year ago from Las Vegas, where I spent about 10 years previously doing similar work. And I'm just so happy to be back around trees, around green space, around water.
Right.
But I think, what just is just such a wonderful experience for me is meeting people in the community. I have met such welcoming people who are just so excited to be here and to talk and share their experiences. It's just been a fantastic experience, and I'm so excited for this work.
Well, again, we'll put the links on where folks can get more information. And when that conversation comes up and the subsequent conversations around the different parts of the area too, we'll make sure those get listed as well on our KMAS website and on the KMAS radio station here. But again, I appreciate some of your time this morning talking about this, and I'm sure we'll catch up down the road as you start to develop the program a little bit more.
Absolutely. That sounds great. Thanks so much for having me.
Thank you.